A patient came to me wanting full smile makeover, new crowns, new veneers. She has been saving for this for years. I took her x-rays, completed full periodontal evaluation, and I told her, we're not starting your teeth today. We're starting with your gums. That's very, very important. It's needless to say, she wasn't very happy to hear that. 6 months later, she came back and thanked me. I'm Dr. Kira, and I help people rebuild their smiles through Smiles Makeover and full mouth rehabilitation. Here's what most people don't realize when they come to my office. They focus on their teeth, but they rarely think about what's holding those teeth in place. Your gums, your bone, your periodontal ligaments. That's the foundation that everything depends on. If the foundation is unhealthy, the gum disease often completely silenced, and you may not even know and be aware about that. And if I place beautiful dentistry on top of unhealthy gums, I'm building a weak foundation. The crowns may look amazing, at least for a while, but if the bone keeps dissolving and the gums continue to recede, eventually the tooth becomes loose. And now you're paying to fix the same problem over again. I see it more often than you think. Patients come with the beautiful, expensive crowns on the teeth and still have 6, 7, 8 millimeter pockets in their gums. 6 millimeter pocket, it usually means you have active gum disease. The crowns are done, but nobody addressed the foundation first. That's not really a cosmetic problem. It is a sequencing problem. And unfortunately, patient is the one who ended up paying for all of it. So what's the right order? This is the sequence I follow for every patient. Step 1, complete periodontal assessment. I measure every pocket. I will evaluate your level of bone using x-rays. Identify exactly where inflammation or bone loss is present. Step 2, stabilize the gums. Before we even think about crowns, veneers, implants, we get the gum disease under control. We have to make sure the gums are absolutely healthy. Sometimes scaling and root planing, that's what the patients need. Sometimes we need to work with periodontists. It depends entirely on what your mouth needs. Step 3, reevaluations. Once everything is healed, I measure everything again. Have the pockets improved? Has the tissue become healthy and stable? Only after that, yes, we're ready for the next step. Step 4, redesign your new smile. And that's the order. Don't skip the steps, because doing the things the right way gives you the best chance for long-lasting results. And if you're wondering where your gum health stands, the first is simply get complete evaluation. If you'd like to schedule one, you can find the link in the description below. So why does all of this matter? Because if you're thinking about improving your smile, you deserve to know the right questions to ask. Ask your dentist, what is my periodontal status? Have my pocket depth had been measured? What do my bone levels look like on the x-rays? Those aren't difficult questions. They are foundations of good dentistry. And remember, gum disease doesn't affect just your mouth. It's been linked to heart disease, diabetes, chronic inflammations throughout the mouth. That has even been linked to some cancer. So it's not just protecting your teeth. We're protecting your overall health. Remember the patient I mentioned in the beginning. We did her smile makeover. We treated her gums first. We let everything heal. We confirmed that the tissue is healthy. Then we built her new smile. Today, her restoration is stable. Her bone levels are healthy. Waiting those 6 months didn't delay the treatment. It protected the investment she made. Gums first, always. I'm Dr. Kira, and I help people rebuild healthy, confident smiles through smile makeovers and full mouth rehabilitations. Now that we've covered the foundation, let's talk about what belongs on top of it. Watch this next, and I'll see you there.